Are you familiar with EMTALA? Are you crystal clear of our rights as a patient or obligation as a provider since the recent federal legislation changes? If you answered no, you are not alone. Let's take a moment to refresh. EMTALA stands for the Emergency Medical Treatment and Labor Act. For details, see our FAQ video here. In 1986, Congress passed the Emergency Medical Treatment and Labor Act, or EMTALA, to make sure that everyone, no matter how much money they had, could get emergency care. Section 1867 of the Social Security Act says that Medicare participating hospitals that offer emergency services must give a medical screening exam, or MSE, when someone asks for an exam or treatment for an emergency medical condition, or EMC, like being in labor, even if they can't pay. So basically, all people who go to the emergency room of a hospital must be checked out by qualified medical staff to see if they have an emergency medical condition or not. EMTALA is in effect until either the medical screening exam doesn't find a medical emergency, or the patient gets stabilizing care and/or is moved to a better place. Then hospitals are required to treat patients with EMCs in a way that makes them stable. If a hospital isn't able to stabilize a patient, or if the patient wants to go somewhere else, the right transfer should be made. The Centers for Medicare and Medicaid Services, or CMS, gave the public new training materials on EMTALA last month. These included a new high-level training video and infographic about EMTALA's general requirements and its complaint and investigation procedures for possible violations. The links are provided in the description box. Again, EMTALA, aka the Patient Anti-Dumping Statute, was passed to make sure that people with emergency medical conditions are not turned away from hospital emergency rooms because they don't have insurance or can't pay. The state survey agency is the place where anyone can file an EMTALA complaint. The state survey agency will look into the problem and, if necessary, make sure the right steps are taken to make sure the hospital is following EMTALA. If a hospital doesn't follow EMTALA, it could lose its Medicare provider status and have to pay civil monetary penalties. CMS says in its Memorandum summary regarding reinforcement of EMTALA obligations specific to patients who are pregnant or are experiencing pregnancy loss, which is mentioned in the training materials and was first published on July 11, 2022, that the purpose of the summary is to reinstate existing guidance for hospital staff and physicians regarding their EMTALA obligations in light of new state laws that ban or limit access to abortion. The summary also states the memorandum is being issued to remind hospitals again of their existing obligation to comply with EMTALA and does not contain new policy law. Remember the recent Dobbs decision by the U.S. Supreme Court? Well, this decision and all the state laws were probably the reason why these new EMTALA training materials were made. The summary reminds hospitals and doctors who have to follow EMTALA that they have to follow the law's screening, stabilization, and transfer requirements in general. There are 5 points that the summary points out. Number 1, the EMTALA statute requires that all patients receive an appropriate medical screening, examination, stabilizing treatment, and transfer if necessary, irrespective of any state laws or mandates that apply to specific procedures. Number 2, the determination of an emergency medical condition is the responsibility of the examining physician or other qualified medical personnel. An emergency medical condition may include a condition that is likely or certain to become emergent without stabilizing treatment. Emergency medical conditions involving pregnant patients may include, but are not limited to, ectopic pregnancy complications of pregnancy loss or emergent hypertensive disorders, such as preeclampsia with severe features. Number 3, hospitals should ensure all staff who may come into contact with a patient seeking examination or treatment of a medical condition are aware of the hospital's obligation under EMTALA. Number 4, a physician's professional and legal duty to provide stabilizing medical treatment to a patient who presents under EMTALA to the emergency department and is found to have an emergency medical condition preempts any directly conflicting state law or mandate that might otherwise prohibit or prevent such treatment. And number 5, if a physician believes that a pregnant patient presenting at an emergency department is experiencing an emergency medical condition as defined by EMTALA, and that abortion is the stabilizing treatment necessary to resolve that condition, the physician must provide that treatment. When a state law prohibits abortion and does not include an exception for the life of the pregnant person, or draws the exception more narrowly than EMTALA's emergency medical condition definition, that state law is preempted. Well, not so fast. In response to this CMS interpretation of EMTALA, the state of Texas filed a civil action in the U.S. District Court for the Northern District of Texas. The state of Texas claimed, among other things, that the Secretary of the U.S. Department of Health and Human Services, or HHS, and CMS went beyond their authority by promulgating rules or regulations mandating that Medicare participating hospitals and their physicians provide access to and perform abortion. On August 23, 2022, the court issued a preliminary injunction to stop HHS from enforcing the interpretations made by CMS in the summary. The court did this because it found that the plaintiffs are likely to win a couple of their claims against the defendants. So pursuant to the preliminary injunction in Texas versus Becerra, HHS may not enforce the following interpretations contained in the July 11, 2022 CMS guidance and the corresponding letter that was sent the same day by HHS Secretary Becerra. Number 1, HHS may not enforce the guidance and letter's interpretation that Texas abortion laws are preempted by EMTALA. And number 2, HHS may not enforce the guidance and the letter's interpretation of EMTALA, both as to when an abortion is required and EMTALA's effect on state laws governing abortion within the state of Texas or against the members of the American Association of Pro-Life Obstetricians and Gynecologists and the Christian Medical and Dental Association. The defendants went to the U.S. Court of Appeals for the Fifth Circuit to appeal the court's preliminary injunction order. At the same time, they asked for a preliminary injunction against the state of Idaho, which had passed an abortion ban that the government said went against EMTALA. As you see, this is an evolving story and the decisions haven't been finalized, so there will be more to come. So you have learned that there are some refreshed EMTALA training materials for everyone to use. You have also learned that HHS guidance on EMTALA in relation to patients who are pregnant or experiencing pregnancy loss has sparked additional legal action. Questions of the day. Were you aware of any of this information? And does EMTALA impact your work? And how is all this back and forth messaging working out for you? Let me know in the comments. My final thoughts. It seems that The impact of the Dobbs decision is far-reaching, and its total impact has yet to be realized. These state and federal battles are sprouting up everywhere and can take years to settle. One way or another, either as a patient or a healthcare professional, we will be touched by this decision. I'm Clarice Warner, the Girl with the Pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment, asking a question, or you can just say hi. But you can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at prncoding.edu. Let's stay connected and connect others. So thank you so much for staying until the end. Let me know in the comments you were here by using the hashtag EMTALARefresh. And also let me know if you have specific questions or items you would like to see discussed in the future. If you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos and don't forget to subscribe for more videos on healthcare revenue cycle content. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks so much for watching.